And so I want us to talk a little bit about the stigma that is associated with HIV. And I know, Sandra, you mentioned this, Ms. Brown, you mentioned this a little bit earlier in our conversation, that there's a stigma that is associated with HIV, and particularly in communities of color. And so let's talk a little bit about that and how we can remove those stigmas, what we can do as a community to remove those stigmas.
But one of the things is, I think a big problem is that when you say HIV/AIDS, we automatically think of you as being gay.
Mm-hmm.
And then we still have problems of accepting people for who they are and not by a title, okay? It's no different than like race. Some people, if you're Black, they don't want you to be their boss or whatever. It's just that kind of thing. The thing is, once we truly remove that this is a disease that anyone can get, and it doesn't have anything to do with your sexual preference or your gender ID, I think that would help. But we still have that block because it's kind of even tied back essentially to our churches, our faith. You know, in some churches, and you know, we've seen this play out in the news. I'm Methodist, this has played out, and they're gonna probably split the Methodist church about people of the same sex being able to marry, okay? So all those things have an effect on this disease. And until we can remove all those barriers, then it's always going to be a problem, because of the fact that we associate this with this disease on it. We can get any other disease, hypertension, diabetes. We don't ever talk about somebody, if you stop eating, you won't have all this. We may say it fun, but we don't push them aside. We just keep eating them.
Right.
So that's the problem. I think, Kenyon, that's my personal opinion, until we remove the barrier of thinking about people's sexual preference first and accepting people and recognizing that this is not a gay disease,
Right.
then we can move forward.
I think that's a whole nother topic of conversation of you know, myths and barriers and taboos in the church, and how, like you said earlier, we are a conservative state, and so getting in the church, getting into places of worship and talking about those things are going to be the first step in educating congregations about these different things, and how, you know, it's a condition just like any other thing. Like you said, hypertension and diabetes, it's how we take care of ourselves is going to matter what the outcome is. And so thank you for bringing that up. Dr. Kelley, did you have anything to add?
Yes, of course, what I'm going to say is that HIV does not discriminate. And so anyone and everyone can possibly contact HIV. So, but it also involves the lifestyle that people are involved in. So if you're in a lifestyle where your contacts have a greater chance of having HIV, your chance of getting cured, but you're higher.
Right.
In the African American community, there's more HIV in the community. And so if you are randomly picking partners in those communities, the chance of you contacting with them is much higher. So we have to educate people, and if you should not take the risk and know the standards of your partner before you get engaged in a relationship.
Absolutely. I think that, you know, sometimes people don't want to have those conversations with potential partners, but it could be, you know, the matter of, you know, whether or not you may contract HIV or not, or some other sexually transmitted disease. And so, like you said, having a conversation with your partner is very, very important. And then also educating yourself is another plus in the whole equation. And so, go ahead.
Okay, I'm probably just not hearing well. What I want to say too is that I want to give Reverend William Robinson over, Hoover United Methodist Church, as the kids would say, a shout out. He has been a leader with the church in addressing this issue. And I think he was ahead of his time, because Jefferson Communiqué was one of the first healthcare facilities, probably the first one to receive Ryan White funding for HIV/AIDS services in the state in 1994. And I know Reverend Robinson acknowledged that he would bring patients here. And so he has been a leader for us, the faith-based community is concerned. But like you say, there's a lot of education, there's a lot of remove the myths. There's another conversation, and just even about communicating with each other, that sometimes we as minorities don't do. Right. And a lot of times we can hide behind the love game. I don't want to go too deep, but there's a lot of things in there.
Yeah. Yeah, and we definitely want to give a shout out to Pastor Robinson for sure. Papa, as a lot of people know him in the community, for bringing programs like the Ryan White program to his church and to faith-based communities. And for those that don't know what the Ryan White Funding Act is, Ms. Brown, tell us just a little bit about what that act is and what it provides, the services that it provides.
Well, Ryan White came about named after the little young boy who contracted AIDS from a blood transfusion. And so they named that act after him. But what it is that community health centers and other agencies have the opportunity to apply for federal funding to help provide comprehensive care to patients with HIV and AIDS, because many of the patients early on did not have the funds. There were not providers. There were not people who even want to see them in private practice, even though it was a disease, because everybody was afraid. But through the years, things have changed in that regard. So I would like to say to anyone that's listening, if you know someone that needs financial assistance or just need a healthcare home, we are here. We provide comprehensive primary care at Pine Bluff and the College Station Clinic for clients who have HIV or AIDS. And even we now do PrEPs, offer PrEP. And we have patients that we are serving. And if you can't afford the medications, we have assistance for that. So we are here to provide services.
And I'm glad that you brought up PrEP. So that's a segue into our next topic of treatment options to both prevent HIV and also to treat HIV. And so let's just start with PrEP. Dr. Kelley, do you want to talk a little bit about PrEP and what it's used for?
PrEP is the pre-exposure prophylaxis, and that is to medication you can give patients who are in high-risk situation to prevent them from actually contacting the disease. So if they are involved in a relationship with a partner that is known to be HIV positive, probably should be on PrEP, or if they're involved in high-risk activities, multiple sexual partners, IV drugs, no thing. So what it is, it's a two medicine combination that decreases the chance of getting the HIV virus. Now, it's not used to treat. So once you actually contact the disease, we will require a different medication, a different combination.
Okay. Are there other medications like PrEP out there on the market, or is PrEP the only treatment or the only prophylaxis for preventing HIV?
Well, PrEP actually there's two medications that have been approved by the FDA to be used as PrEP. One is Truvada, and another one is Descovy. So there are two medications that have actually been approved for to actually prevent the transmission of the virus.
And so let's talk a little bit about treatment options for those who have contracted HIV, those who are HIV positive. What treatment options are available for them?
There are a wide variety of medications that have been approved by the FDA for the treatment of HIV. And they basically fall into, 4 broad categories of medication. And I don't have to get the details of those, but 4 groups of medications have been approved. So when a person is treated for HIV, they're going to be basically given, a 3-drug combination, and more recently, then even a 2-drug combination can be used to control the virus, suppress the virus to the point that it's undetectable.
Okay.
So if patients take the medication as prescribed, They can be treated, virus suppressed, or treated to the level of becoming undetectable and live a normal life.
Okay. And so
I would like to brag a little here.
No, go ahead. Go
Okay.
ahead.
Now, what I was about to say is when Dr. Kelley was talking about violence suppressed, our recent numbers on that clinical measure, greater than 80% of all patients are violence suppressed. And I think the national average is about 88% in 2019. And we're in the 80 percentile. So
Okay.
that's really good for
Absolutely.
patients with HIV.
Absolutely. And so talk just a little bit more, either you, Ms. Brown, or Dr. Kelley, when someone is virally suppressed, does that mean that they can no longer transmit HIV to like their partner or someone? What does that mean if you're virally suppressed?
Viral suppressant basically means the HIV in the blood count is less than 200. But we actually aim for basically being virally undetected.
Okay.
So if they're undetectable, the chance of transmission of the virus is almost nil.
Okay.
Less than 1% chance from it.
Okay, gotcha. And so is there a cure for HIV or no?
As of now, there's no cure for HIV. There's no cure for HIV, and there's not even a vaccine for HIV.
Okay.
But patients should be, they should be aware that there's good treatment, excellent treatment.
And so just one final question. You guys talked about some of the services that Jefferson Comprehensive Care provides. Talk a little bit more about, the services that you provide for your HIV patients and just the general population.
We provide, treatment for, acute disease along with the management of chronic diseases. And the chronic diseases include diseases like hypertension, diabetes, asthma, and so HIV fall into one of those chronic disease categories. And we basically manage them the same way as any other chronic disease in the clinic. And so when you're managing the chronic disease involved, patients being actively involved in their own treatment, and making the necessary lifestyle changes. So we also provide nutritional services for our patients, and we have social workers who provide a wide variety of social services for our patients.
And one of the things too, we have transportation services for our patients. And what makes us, I just really want to point out with our HIV patients, we provide comprehensive primary care services. Many people just treat HIV, but we discovered that many of the patients did not have a medical home. So yes, they may have HIV, but they also got hypertension and diabetes. So the provider takes care of all those needs so that you don't have to go over here for your blood pressure over here. It's comprehensive services. And as Dr. Kelley said, we do that with all our patients.
Okay.
Let me bring one other point. We talk about patients with HIV or patients with AIDS. Many patients now are living and practicing a normal life. In fact, more than 50% of the patients with HIV are above the age of 50. And so they're having the same chronic diseases as anyone else in the population. So patients with HIV now don't really die from HIV. They die from heart disease, die from cancer, the same thing the general population die from. So that's what we manage in our patients. It's not just managing HIV, but it's also managing the blood pressure, the cholesterol, and doing those preventive things to keep it from dying from other diseases.
Right. Gotcha. And so Jefferson Comprehensive Care is truly that comprehensive. You guys take care of everything and everybody, regardless of whether or not you have HIV or hypertension, diabetes, asthma, anything, just a normal health clinic. And
Health services too.
Health services, absolutely. And provide transportation for those who may need some transportation help as well. Yeah.
Another thing we do, of course, we collaborate with the specialists in the communities in which we work in. And so if someone has infections that I can't treat. We have the specialist with infectious disease, endocrinologists, and so we consult with the specialists in the area to make sure our patients are getting the best of care that's in the community.
All right. And so just one final thought. What you say to someone who is a family member or friend of someone who has HIV, how would you encourage or advise them to support their loved one or their family member who has HIV?
Well, the thing is, I would tell them, just like with any other disease, be supportive. It's not a death sentence. Encourage them to maintain healthcare appointments and just treat them like you do any other family member. There were times people were afraid to be around them just because they thought something was going to jump on them, but you don't do that with any other disease. You don't do that with cancer. You don't do that with high blood pressure. So just be encouraging, be supportive, and be a friend. Be there for them. Don't be afraid of them.
Absolutely. Absolutely. And with that, that's a wrap. Thank you guys so much for spending some time with us, Ms. Brown and Dr. Kelley. We so appreciate you, and just continue to do what you're doing to provide excellent care to the community.
And thank you for inviting us.
Thank you.
All righty.